Of COVID-19 medicine in Senegal as the world intensified efforts in the search for vaccine for the COVID-19 pandemic. Senegal is not left behind in the process for a lasting solution. The West African countries producing herbal tea from the artemisia leaves as treatment for the coronavirus. The factory, located some 50 kilometers from the capital city, Dakar, began the production of large quantity of the tea as the demand from the public increases. Let's have more details of that in this report.
Senegal has joined the race against time to find the ideal remedy to treat the COVID-19. It's producing a herbal tea made from the artemisia plant. The artemisia leaves are first dried before being transported to a processing plant about 50 kilometers from Dakar. Women at the factory sift through the leaves, which are later put into capsules or tea.
In the early days of coronavirus, we saw our production as well as our sales increase because there are many people who are already familiar with this plant and its effect on strengthening the immune system. We went from an average production of 3,000 to 4,000 packs per month to 2,000 packs per day. We can say that the demand is still there and that today the scientific world is very interested in artemisia.
Passer de 20 paquets à 300 paquets par semaine et puis dès que le président
Sales have really gone up. Initially we went from 20 packages to 300 packages per week. Then we went from 300 packages per week to 300 packages per day. I had one client who complained at the beginning of fever, itchy throat and so on, and she was very upset. But after taking the artemisia capsules, within 24 hours, the symptoms had completely disappeared.
Le stock se vide, c'est incroyable, assez incroyable.
According to some scientists, artemisia is a plant that eradicates 98% of malaria, bilharzia, and certain skin diseases. However, clinical trials are yet to be conducted to evaluate its effectiveness and determine its effects on the human body in relation to the coronavirus.
Un comité scientifique a été monté.
Here in Senegal, a scientific committee has been set up and has already presented a research protocol for the validation of this plant. Protocol has been submitted to the Ministry of Health and we're just waiting for the authorization of the Ethics Committee for its validation. Then we will be able to start the tests first in the laboratory and continue with clinical trials on patients on the basis of informed consent.
The WHO has warned that there is no proof that medicine derived from the plant can cure COVID-19. As people await the official decision on whether to continue clinical trials of artemisia, they continue to obtain the capsules and tea products as a preventive measure,